Okay, I am back for my cord cutting demonstration. I have my baby with umbilical cord that is attached to the placenta at this time. I have some non-sterile gloves, I have a cord clamp, I have some gauze, and sterile scissors that are no longer sterile, but they would be in this case. I like to talk to families about what their wishes are for cutting the baby's cord prenatally, because some people have some fun ideas, some people want to leave it intact and have a lotus birth. The last birth I was at, the parents actually had a pocket knife engraved for their baby and wanted to cut the cord with that knife. So I think it's a good idea to have a conversation prenatally and know what the family wants. So after the baby's born, everybody's happy, baby's transitioning well. Hopefully we're leaving baby attached to the placenta until the placenta comes out, unless it's some sort of an emergency situation. We need the baby to be detached from mom, but generally in an emergency it's a good idea to keep that baby's oxygen flow through the placenta connected. That's a positive thing. So we'll ask the parents what their wishes are for cutting their baby's cord once again, so we're not making any decisions for them. And so when it's time to cut the cord, we get the baby all situated, and placenta's usually in a bowl, and I put on gloves to help assist the parents. Sorry, dogs are making noise out there. If the parents are doing it, and then I'll give them some guidance. These gloves are not powdered and they're sticky. So I've got my cord clamp here. I'm going to make sure to hold the baby's arms and legs and make sure that I'm not going to be cutting the baby. I usually clamp the cord about an inch away from the umbilicus, just in case something were to go awry or baby wasn't transitioning well. That allows for emergency personnel to place an umbilical line if they should need to, which is the easiest way to get a line into a newborn. So clamp the cord about an inch away, leave it long. It can always be shortened later, but you can't make it longer. So the cord has stopped pulsing at this time. It's flat and white, just like it looks here with this ribbon. And so I've explained to the parents that, you know, the baby's not getting any more blood, but there may be some residual blood, and when the cord is cut, there might be some blood that like squirts out of it or something, and that's just residual that was just laying there inside the vessels. So for that reason, we put a gauze pad behind the clamp so that that catches the blood. It doesn't go on the baby or mom or sheets, whatever it is. And then we grab our scissors, and if the parent is choosing to cut the cord, I just tell them that it's going to be a little bit gummy and you might have to saw through it. It doesn't always go, you know, in one cut, and that's fine. So they're going to place the scissors on the end that is not by the baby, and I'll be holding the baby's legs back so that baby's not going to get cut. And then you just kind of saw at it and set it free. Some blood might come out on the gauze pad, and then baby is free and the cord is cut. And then baby goes with, usually with mom, to start nursing. Yeah, that pretty much sums it up. I can't turn it off with these gloves.